You know that feeling? That uncomfortable, gassy, bloated feeling you get after a meal sometimes? Is that just normal? Or could it be a sign of something more? Well, today, we're going to decode the signals your gut is sending to figure out what's really going on.
And that's really the big question, isn't it? Knowing the difference between just some normal digestive noise and a real signal that needs your attention, that is absolutely key to your well-being. So let's learn how to listen to what our bodies are telling us.
Okay, first things first. Before we can even begin to spot what's abnormal, we have to get a handle on what's totally normal. And that starts with two things almost everyone experiences: gas and bloating. So let's get one thing straight right off the bat. Gas is not the enemy. It's a completely normal, actually even healthy, sign that your digestive system is doing exactly what it's supposed to do. It's just what happens when your body breaks down food. Simple as that.
Now, you might think food is the main culprit here, but look at the pattern. A huge chunk of it comes from just swallowing air. You know, from eating too fast, chewing gum, or chugging a fizzy drink. And the rest? Well, that's just your gut bacteria having an absolute party with all those healthy, fibrous foods like beans and cabbage.
And then there's bloating. That, I feel like a balloon sensation. The most important word to remember here is temporary. If it happens once in a while and you can pretty much trace it back to a big meal, it's usually just your body's normal response. Don't worry, it'll pass.
But what happens when temporary starts to feel a lot more permanent, when it's more than just an occasional thing after eating? Well, that's when we need to start talking about a specific condition: irritable bowel syndrome, or IBS.
Okay, this definition is so important. IBS is what's called a functional disorder. What that means is a doctor could literally look inside your gut and everything would appear perfectly healthy. The problem isn't the hardware, it's the software. It's not about the structure of your bowel, but how it functions. It's a long-term condition that's all about having an extra sensitive gut.
So what's the real telltale sign here? It's not just about having gas or feeling bloated. IBS is a whole cluster of symptoms. The big giveaways are that recurrent pain combined with major changes in your bowel habits, swinging from diarrhea to constipation. That whole pattern, that's the classic signature of IBS.
And this brings us to the most important part of all of this. We've looked at all the individual pieces, so now let's put them side by side. This is where we really nail down the difference between a temporary symptom and a chronic syndrome.
And this slide just lays it all out, doesn't it? On the left, you've got that occasional discomfort. It's short-term, you can usually point to that fizzy drink or that giant bowl of chili, and it's basically harmless. But on the right, you've got IBS. It's long-term, chronic, the symptoms keep coming back, and critically, it's tied to those changes in your bowel habits. It's really the difference between a random rainy afternoon and an entire rainy season.
Okay, so now that we can hopefully spot the difference, what can we actually do about it? In our last section, we're going to cover some simple steps for managing your gut health, and maybe even more importantly, how to recognize those big warning signs that mean it's time to see a doctor.
These are all so simple, but they are seriously powerful. Just eating slowly, it does way more than you think. It directly cuts down on how much air you swallow. A food diary is like being a detective for your own body. And hey, never underestimate the power of a good walk or just finding some quiet time to de-stress. That connection between your brain and your gut is incredibly strong.
Okay, listen up, because this is probably the most important part. While most of this stuff is manageable, some symptoms are just non-negotiable. These are the red flags that mean you need to stop self-diagnosing and call a doctor right away.
Seriously, if you experience any of these, it is time to make that appointment. Unexplained weight loss, any blood in your stool, pain that's severe and just won't go away, or symptoms that are bad enough to wake you up at night, these are all signs that require immediate medical help to rule out anything more serious.
And it really all comes back to this one idea. The most powerful tools you have for your digestive health probably aren't in a medicine cabinet. They're awareness, just paying attention to your body's patterns and finding a balanced lifestyle. What you eat, how you move, and how you manage stress.
So, as we wrap this up, I'll just leave you with this question to think about. It doesn't have to be some massive life overhaul. Maybe it's just slowing down during lunch today, or swapping one soda for a glass of water. What's one small, totally doable step you can take for yourself starting right now? Thanks for tuning in.